Today we're going to talk about pelvic tilt and the differences between anterior pelvic tilt and posterior pelvic tilt and how these conditions could be contributing to your back pain. We're also going to talk about how you can use pelvic tilt for getting out of back pain. And I'm going to show you an easy way to tell if you have anterior or posterior pelvic tilt if you're unsure. What's going to follow is a video taken from the Core Balance Training archives, and I want to give credit to the University of Lyon in France for their visually stunning images of the 3D anatomy of the body, which I've used in this video. So here we go. The pelvis doesn't normally sit flat like this line does here. It actually does naturally have a little bit of anterior pelvic tilt. So if you know that you have anterior pelvic tilt, it's not an immediate reason to worry, but there's a possibility that your pelvis could be tilting too far forward. Anterior tilt is arched back. If you feel like your back is arched, then this could be a contributing factor. And posterior tilt, another name for it is flat back. Scoliosis would be lateral tilt, tilting to one side or the other. Here it's showing the hips, so you can see the ball in socket joints and how the pelvis rolls on top of it. And you can see how the pelvis tilts in 3 dimensions. You can see this is anterior tilt, and the vertebrae are closing down in the back. They're approximating, getting closer together, and they are getting farther apart in the front, giving more space for the discs in the front, but compressing them in the back. You can see with a more detailed version of the discs, a little bit of compression called stenosis, the closing down of the back of the vertebrae, where these can actually touch each other. That causes problems because there are nerves and blood vessels that come out of the spine, out of the spinal cord and into the legs. And so we want to have space here. And that would be probably the number one problem that anterior pelvic tilt causes, is the closing down of the space needed for the nerves and blood vessels to exit. And if you feel nerve symptoms in your legs, it's possible that this could be the cause. If you've been living in a certain position for so long, the vertebrae over time, through repetitive trauma, start to break down and they can slide forward. And that would be called spondylolisthesis. There is repetitive trauma that occurs from doing activity, doing life with your body in that position. So because of my muscle imbalances and I was in the predictable pattern, this is how my pelvis lived, and I would go play basketball. Imagine jumping up and down playing basketball with your spine in this position. It's going to crunch the back of the spine. So for that reason, it was beneficial, and it still is beneficial for me to bias towards a posterior tilt. And so a lot of people can do that. You can use posterior tilting as a strategy to protect your spine. So this is posterior tilt. So you can see the flattening of the curve in the lumbar spine. The pelvis gets to about level here, but it is posterior tilt. The pubic bone comes forward, and what you can see is the space opens up in the back of the spine. Now, this could be a useful strategy for someone that has stenosis. Someone that lives in stenosis naturally may want to bias themselves towards a posterior tilt if they need to create more space there for their nerves and blood vessels. So you can see opening up and closing down, but it's not quite as bad in the front. And so this is one of the reasons why in the Core Balance Training program we do bias towards a posterior tilt. It seems to be a safer position for the spine and potentially has less consequences. So these are representative of the muscles. This would be the abdominal muscles, and this would be the glutes here. So the glutes and the abdominals work together to create this posterior tilt. These are 2 of the muscles that tend to become inhibited or weak and lengthened in the predictable pattern of muscle imbalances that we see across society, largely related to sitting, which would explain why we tend to bias towards an anterior tilt, because there's not enough tension in these muscles. They're not active enough. This is the most common pattern, the most predictable pattern, and I would say that about 80% of people who are experiencing chronic lower back pain are in a more anterior tilt situation with their pelvis. In order to correct the problem, we want to reactivate these muscles that help us move towards a posterior tilt. We don't want to go into a complete full posterior tilt. That would be a compensation. It's not a solution, and that can cause problems because when we are in a posterior tilt like this, the discs are getting stretched out a little bit. So if somebody has a disc injury, then that could be causing soreness, tenderness, and pain in that way. There is no one clear answer. What is better, anterior pelvic tilt or posterior pelvic tilt? The truth is that the best position for the spine is neutral. We want to move towards neutral, and the way that we would do that is moving towards posterior pelvic tilt. And most likely, if you have lower back pain, you have a little bit of anterior pelvic tilt. One sign or symptom that indicates that your pelvis lives in that position of anterior tilt is if you're laying on your back and your legs are straight, so your knees are not bent up. You're on a totally flat surface and you feel a lot of tension in your lower back, almost like it's trying to lift up off the floor. That would be an indicator that there's some really tight muscles, namely the hip flexors, that are pulling up on your spine. And if it's uncomfortable, then that would be an indicator that your pelvis is probably in that anterior pelvic tilt position. The opposite of that will be your spine is pushing on the floor. It's not slightly curved up off of the floor. Then that may mean that you have a posterior pelvic tilt. Does core balance training work for both anterior and posterior tilt? And the answer is yes. The program was designed to help everyone, whether you live in anterior tilt or posterior tilt, to achieve neutral. To the right of where my mouse is, the skeleton showing the 3 anchors. These are the foundations of the program. These 3 anchors are a system to support the spine that you can rely on, that you can lean on, which will naturally bring the spine into a neutral position and the pelvis into a neutral position, whether you live in anterior tilt or posterior tilt. By connecting with these anchors and creating this foundation of support, that's achieving what I like to call core balance. You can lean on this. You can use it like a brace, which naturally holds your spine in a neutral position. The back anchor is the first week, and we spend an entire week to learn one exercise. It's called the bridge. If you can maintain this connection with the back anchor here while doing the bridge, it feels so good. No matter who you are, if anterior, posterior, because remember, the program brings us to neutral. Then in that next week, in week 2, we learn the 2 front anchors. So that's the upper front anchor in the front in the rib cage, and the lower front anchor on the pubic bone. So that would be here. And so we learn how to bring the pubic bone forward like that. Okay, that's connecting the front anchor. And we first used the floor as a cue because that's how we first learned when we were infants and babies developing our core. And so we mimic that. We model after how we first learned so that we can start over and hit reset with our movement and learn how to reconnect with the deep spinal support muscles. When the 3 anchors are combined together, it's called the anchor triad, and it's a natural back brace. Everything can get better. I have not met somebody in my career that can't improve. Even if the damage is already done, for some reason, if you can give it more support and you can begin to correct the problem, things start to feel better. We appreciate you here at Core Balance Training for leaning into your health, and it makes us want to lean back and give you more education and more of what's going to help you to climb out of the spiral of back pain. So until next time, get down on the floor and connect to your core.